Good day po, my name is Dian. I will be your physical therapist for today. How may I address you po?
Ma'am Elisa na lang.
Okay, Ma'am Elisa, good day. Welcome po to our clinic. So I understand that you went to our clinic because of your condition called COPD. And as physical therapists, we have prepared examinations and interventions for your condition. Okay, so we have prepared two of each. So for the examination, we have prepared tactile fremitus and auscultation. So let me explain first the tactile fremitus, no? Tactile fremitus is the use of the therapist's hands or my hands in order to assess for your lung vibrations because normally our lungs produce vibrations every time we speak. So with the use of tactile fremitus, we will be able to assess on how the vibrations of your lungs looks like right now. Okay, so for the auscultation, on the other hand, I will be using a stethoscope and I will be placing this on different parts of your body in order to assess for your breath sounds to see whether what your condition your lungs are right now. Okay? So I have mentioned that I will be using my hand on different parts of your body, which means there will be a direct contact. So I'll be handling you po. Would that be okay?
Okay.
Okay, so let's first proceed with the posterior part of the tactile fremitus and auscultation. For the tactile fremitus, we'll be following the posterior landmarks, which is medial to the superior angle of scapula, medial to the scapular spine, medial to the inferior angle of scapula, and lateral to the tent ribs. Okay, so ma'am, I will be using this side of my hand, and what I want you to do is that when this hand touches your back, you will say the words stress, stress. Can you repeat it for me?
Stress.
Please speak it in a loud and clear voice po, okay?
Stress. Dalawa.
Ayan. Yes, dalawa po.
Okay.
So, let me just palpate, no, for a better precision of the locations. You can go na po, ma'am.
Stress.
Okay, good. Another one.
Stress.
Okay, another one.
Stress.
Okay, another one.
Stress.
Okay, you may now relax po for a few seconds. And now I will be using my stethoscope for the auscultation in the posterior view. Using the ladder pattern, we will check for your breath sounds. Okay po? So, once this touches on your back, you just need to inhale and exhale. Pero normal breathing lang po. Hindi niyo po kailangan mag-breathe deeply. Okay? Understand po? Okay. So, first, palpate lang po ulit natin. Inhale. Exhale. Next. Inhale. Exhale. Next. Inhale. Exhale. Next. Inhale. Exhale. You may now relax po. Is everything good po, ma'am? Still comfortable po?
Okay.
Okay po. So now we will proceed in the anterior part for the chest. So again, we will be testing for the tactile fremitus as you remembered earlier that you will be speaking the word stress in a loud and clear voice, and at the same time I will be doing auscultations where you will inhale and exhale. Okay, so just the same but different landmarks. Okay po? So for the anterior part ng tactile fremitus, you will be putting it above the breast, medial to the nipple, and lateral to the nipple. For the anterior parts of auscultation, it would be above the clavicle, below the clavicle, slightly above the nipple, medial to the nipple, lateral to the nipple, and lateral to the tent rib. Okay, so are you ready na po? Okay, so once this places your chest, you will see the words
Stress.
Okay, good. So, first, go po.
Stress.
Good.
Stress.
Next, with the use of my stethoscope, I will be following the ladder pattern in the anterior chest. Okay, so once this strikes your chest, you will inhale and exhale normally lang po. Okay? Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Are you feeling good po?
Mm.
Okay. So, based on my findings in the tactile fremitus where I should assess for the lung vibrations, I have noticed that there is a decrease in vibrations. Why? It is because there is a lot of air trapped inside your lungs, and this is because of narrow airway spaces, making the air trapped inside the lungs. Therefore, it is making you hard to breathe sometimes, no? And also resulting to decreased vibrations here in tactile fremitus. So, next one would be for the auscultation. I have noticed that you have an existing abnormal breath sound, which is wheezes. So normally, a normal healthy lung would sound like as if an air just comes in and out of the lungs continuously. So I have heard something like wheezes, like blowing off a horn. So this means just like the tactile fremitus, no, there are a lot of air trapped in your lungs because there is narrowed airway spaces. Okay, so yun po. So again, we have prepared two interventions. I will explain first the airway clearance. So the airway clearance, from the word itself, we will try to clear your airways because as I have explained earlier, your airway spaces become narrow. Why? Because of the presence of excessive mucus. So with airway clearance, we will try to move out the phlegm or mucus outside of your body. This is through control of breathing, and I will teach you how to properly cough. Okay, so the proper cough would be sharp and deep. So I will be teaching you po, like this po. Okay, that's good. So we will be doing this for 2 times and we will repeat this 3 times. So like this po. For 1 repetition, you will try to cough. Okay, that's good. So you will repeat this for 3 times and inform me if you feel any mucus coming up on your throat. Therefore, I have prepared a sputum cup. Assuming that this is a sputum cup, you will release your mucus here. Just inform me whether it is ready or not. It is normal that you may not release it, but the purpose of this examination is to clear your airways for the sputum to be released easily. So you may notice that after you come home, it is more easier for the mucus to be released. Okay, so it's normal if you don't release it today. But just in case, we have prepared a sputum cup. Okay po, so again, you will cough for 2 times and we will repeat it for 3 repetitions. So inform me if you are already experiencing a shortness of breath so we can stop it immediately. Okay po? For the first repetition, okay. Second repetition, okay. For the third repetition, so do you feel already the mucus coming out po?
Wala naman.
Okay, so none. So yes, it is normal that you may still not feel it today, but afterwards when you came home, you will see the effects of it. So next one would be pursed lip breathing. I will be teaching you this in times that you might experience shortness of breath because based on your history, you experience shortness of breath after activity. And sometimes shortness of breath is a risk factor of having hyperventilation, where you are always out of your breath, and this is not normal. Okay, so it can lead to more serious problems. So I will be teaching you first deep breathings for you to have a breathing control in times that you experience a shortness of breath or what we call dyspnea. So what I want you to do is just inhale through the nose and exhale through the mouth like you are blowing out a candle. Okay po, so can you remove your mask po so that we can see? So I will be explaining this po first. So first, you will inhale through the nose and exhale through the mouth like blowing a candle. Okay, you will repeat this for about 3 to 4 times. Okay po? So, you can try it on your own po. So, for the first repetition, inhale and exhale through the mouth. For the second repetition, inhale and exhale through the mouth. For the third repetition, inhale and exhale through the mouth. Now for the last, inhale, good, and exhale through the mouth. Okay, you're doing good po. So, are you feeling okay? Okay. So, based on the interventions, this will help you control your breathing more in order for you to be independent, no? In times that you will have shortness of breath, you will use this first deep breathing at all times. And at the same time, you can do the breathing exercise at home, diba? Like the proper coughing so that you can release the excessive mucus easily. So, thank you po for your cooperation. This is again Miss Dian, your PT for today. Thank you po.